Welcome back to Mapping Healthcare on KDRT 95.7 FM in Davis, California. A radio show and podcast where a medic with a map explores healthcare around the world, highlights people who improve it, and shares what we can learn from them. This is your host, Dr. Sheikh. It was late 2020. The COVID-19 pandemic was raging. There were widespread shortages of masks, face shields, and gowns in hospitals. Healthcare staffing was stretched beyond its limits. Hospital beds were full, and vaccines were still being developed. In today's episode of Mapping Healthcare, we delve into a crucial concept that has rapidly gained attention: health system resilience. From global pandemics to local emergencies, the ability of a health system to withstand and recover from shocks is paramount. But what exactly does resilience mean in this context, and how can we build it? Let's explore. The idea of health system resilience has really taken hold in the last decade or so. Events like the West Africa Ebola outbreak in 2013 truly highlighted just how fragile and interdependent health systems can be. While it seems like a straightforward idea, defining health system resilience isn't as easy as it sounds. It doesn't have a clear-cut definition, and there are challenges in measuring it. There's also a concern that focusing on resilience might move the responsibility for coping with crises onto those who have the least power, like already struggling families and communities. Some people even worry that it could normalize coping strategies that are not based on evidence or that are actually harmful in the long run. Despite these concerns, the idea of resilience continues to be important because it points to a vital quality for complex systems when they face both sudden crises and ongoing pressures. So, what are the core features of resilience that people generally agree on? One of them is about the conditions that require resilience. These could be sudden shocks like disease outbreaks, hurricanes, earthquakes, or cyber attacks, things that put an immediate and significant stress on the healthcare system. They also include stressors, which are the persistent everyday challenges, such as chronic underfunding of healthcare, health worker strikes, or health policy changes. It's important to remember that these shocks and stresses aren't isolated. A pandemic, for example, can become a long-term stressor, and chronic problems can make a system more vulnerable to acute crises. These stressors also vary in how big they are, how often they happen, and how long they last. Also, resilience is about what a health system does or can do when faced with these challenges. A resilient system can maintain its core functions and minimize the negative impacts of disruptions. A resilient system can also learn from these experiences and improve its performance. Ultimately, a resilient healthcare system can absorb shocks, adapt, and transform to become better prepared for the future. Resilience isn't the same as just having a strong health system. A system might be strong in stable times but then completely fall apart when a major shock hits. Or a system might be resilient in the face of adversity but still underperform in normal conditions. A key takeaway is that resilience isn't just about individual parts of the health system. It's fundamentally about the connection between these elements. You can analyze a health system in terms of its structure, but truly understanding its resilience requires looking at how various parts interact as a whole. Power dynamics, social pressures, religious beliefs, political structures, and global economies can all influence how a health system responds to a crisis. In short, we are all connected. Our guest on today's episode of Mapping Healthcare is Dr. Elom Otchi, who is the Technical Director of the Africa Institute of Healthcare Quality, Safety and Accreditation, based in Accra, Ghana. The views expressed on the show are mine and those of my guests. So, Elom, welcome to the show. You work at the Africa Institute of Healthcare Quality, Safety and Accreditation. It's a healthcare quality and patient safety institute in Africa. The organization is one of the few on the continent that trains and prepares healthcare professionals and helps organizations design quality management systems so they can improve upon the quality of healthcare and outcomes. And in Ghana, you've been really active in the area of quality and safety. So tell us a little bit about your professional background and your career path to the work you now do.
Yeah, so I think I have had a very mixed path. I started originally as a biomedical scientist. I worked in one of the regional hospitals in Ghana, and then I went to head one of the district hospitals in Ghana. And then I moved on from there. I teach in the university part-time, the School of Biomedical and Allied Health Sciences of the University of Ghana, where I train allied health professionals, including biomedical scientists. I have done some postgraduate programs culminating into my PhD in public health. And then my area of interest was in quality and patient safety.
You work in Ghana, but you also work in other parts of Africa. So let's first just start off with the area that you live in. What are some of the critical challenges facing health systems in Ghana today?
I think that key will be service delivery and organization of service delivery. If you take issues of clinical effectiveness, our outcomes is not the very best. You take maternal mortality and all other mortalities, we are not doing so well. What we are having currently as the double or triple burden of diseases, infectious diseases and non-communicable diseases, all of it rising up at the same time. But unfortunately, our service delivery organization is not up to the task as far as catering for patients who have these conditions is concerned. The other bit is the bit on fragmentation. So there's a lot of compartmentalization as far as service delivery is concerned, even in the same facility. So sometimes you have to go and pay at point A, collect your receipt, bring the receipt to point B for it to be verified, and then you go to point C where the healthcare provider is. He or she will also take a triplicate of the receipt and make a verification of the payment before the service is provided. So, I mean, at the end of the day, you would have made a lot of stops in the same facility. And sometimes you need a diagnostic service because our system is still evolving. You hardly will get one facility that would have all the services available. So all of these compartmentalization and fragmentation affect the quality of care. There is also the bit about issues of emergency response, timeliness to care. And we did some study in one facility where in an obstetric triage system, for instance, we realized that the average waiting time, this is in an emergency, was about 4 hours, 30 minutes. The other area has to do with the safety aspect, issues of medication safety, surgical safety, infection prevention and control are all some key issues. But I should quickly add that if you look generally across the continent, it is not any different from one country to another. There's a lot of wave on the development and implementation of national quality strategies. So there are some pockets all across. I think that is good with the necessary support and continued interest by countries and governments. I am sure that in the next few years, we should be able to rewrite the story of the continent.
I really can relate to some of the experiences you described when you mentioned the issue around fragmentation. I work with children with medical complexity and see how care is fragmented when they visit, for example, an emergency department outside my health system for care, and then visit an urgent care or same day clinic outside my healthcare system for care, and then come back to my clinic and trying to patch all of those pieces together and get a complete picture of what happened to the child despite these care fragmentation issues that occurs always challenging for clinicians. So I'm glad that work is being done in your area as well to mitigate some of these issues. So, one of the things we see in healthcare improvement is that once people launch healthcare improvement initiatives, there are concerns about sustaining these efforts. This problem is all around the world, including in the settings that I work at. So, you face the same concerns in Ghana. What are some factors that play a role in sustaining quality improvement efforts in Ghana?
I think that one of the first for me will be commitment. And if I say commitment, it is commitment backed by resources. So for me, what I have seen, and this is also not only in Ghana, but across the continent, that governments will say they are committed. They are committed to the policy. But you realize that when it comes to funding, and backing and pushing the policy with the necessary funding and resources, then you see evidence lack of commitment in that area. I think the other is funding generally. So there is a challenge with prioritization.
And this episode focuses on developing resilient healthcare systems. And, over the last 5 years, all around the world, the COVID-19 pandemic and its aftermath has really changed how we view health system resilience and how we change our work going forward. You and I collaborated a couple of years ago on one of these issues, the rapid rise of telehealth during the COVID-19 pandemic and some of the quality and safety issues that we need to consider with this rapid rise of health technology that occurred, right? So, the good and the bad of such technology. So, the COVID-19 pandemic really shook things up in the world of healthcare and in many instances helped us see things in a new light and make things more resilient going forward. How did the COVID-19 pandemic change the priorities or projects of the Africa Institute for Healthcare Quality, Safety and Accreditation, or FIXA?
One of the key things for us is it taught us that we could leverage on technology even more. The second thing is in the area of collaboration and partnership. COVID, another thing it taught us is that, no one institution has it all. And even for countries as well, that lesson was very evident. So it has strengthened our relationships with other like-minded individuals and organizations.
Yeah, and so with Afixa, the organization you work with, you worked on a model to build quality resilient health systems to hardwire some of these changes so that, the next time the big next public health emergency comes around, that some of the quality and safety approaches you have continue to do well. So tell us some of the key features of this model that you have with your organization for building quality resilient health systems and what others could learn from it.
For us, one of the key features has to do with leadership. And when we talk about leadership, it is the leadership both at the front line and then the positional leader, which are very key and very fundamental for us. And it is not a one-off event. And the other key feature for us has to do with the systems strengthening. We are looking at the ability to ensure that all the building blocks of the health system are sufficiently strengthened. For instance, where you don't have the requisite human resource, skill set, competency to deliver quality, any other thing you do is sinking sand and you will not attain much.
You brought up two really important points in this model for resilience, the importance of leadership, and then you mentioned system strengthening. One of the other components that I think is key to both of these issues that your model speaks about is situational analysis of quality management capacity. So, this basically involves evaluating an organization's current capabilities to manage quality across the organization, thinking about internal strengths, internal weaknesses, external factors like market demands, you mentioned outside aid, industry standards, to identify ways to actually understand where some of the pitfalls might be once there are shocks to the system, right? So I want to maybe try to have you give us one example of how a hospital or clinic or other healthcare facility that your team worked with did that, how they analyzed, did a situational analysis, or what could be some of the issues that could occur once the next pandemic or healthcare disaster comes around.
So currently, I've worked in about 10 countries and still counting. So for the situational analysis, key is identifying your key stakeholders, isn't it? You will have to make sure that you are touching the root cause of the situation and the issues in the country. But unfortunately, a lot of people touch the symptoms and the branches other than the roots. So the propositions they make do not hit the core of the health system. And at the end of the day, they leave and the system virtually collapses in their absence. Most of the feedback I often get when I do a situational analysis is, hey, how long have you stayed here with us? And I apply a multitude of data collection methods and approaches, both surveys and meeting people one-on-one and having a deep dive. I mean, one of the things I have realized is that people know what the issues are. People want to confide in people.
Yeah, you brought up a couple of really important points where you spoke about not just using healthcare data, but also using these deep conversations with people that work in the system to understand what's going on. And also, the next thing that I completely agreed with was just this spending this time to understand before you jump to interventions. I've seen that in many settings where people come in with their preconceived notions of what the intervention needs to be and jump right in. And then, after spending a lot of time and effort and resources and hours on that work, find that maybe it was not the right thing to do. But looks like your team thoughtfully does a deep dive and understands the situation before you run into design and intervention. So I think that's really key to finding out how to make our health system resilient is having those conversations first. So, health system resilience is the ability of a health system to prepare for, respond to, and recover from shocks to the health system. And we've seen several of those types of shocks over the last few years. Of course, there was the pandemic, there's climate change, there's cybersecurity threats to our health systems that rely a lot on electronic records and technology. And resilient health systems can maintain healthcare quality even during these threats and crises. So, what are some ways technology is being used in Ghana to help build health system resilience?
It varies. In a lot of the labs, for instance, now fasting blood sugar, for instance, is automated analyzers, full blood counts, very automated analyzers are being used. If we look at the radiology as well, we have MRI, we have a nuclear medicine center with all the sophisticated machines for cancer therapy, all kinds of cancers in our National Nuclear Medicine Center in Kolebu, for instance. So as far as technology is concerned, it is helping in diagnosis. It is also helping in treatment. So it is being used variedly. But I think that as a country, we have not sufficiently taken hold of the power of technology, and especially also in the area of artificial intelligence, for instance. Comparatively, I will say that the private sector is way ahead of the public sector when it comes to the use of technology, for instance, in driving improvement. There is the use also of medical records systems that are being used. The ministry, for instance, has launched a very ambitious program, which is the health management information systems across the tertiary hospitals. Now, all the regional hospitals are using SAME, and then they are deploying to the district hospitals as well. But I feel that we still have a very long way to go as far as the use of technology in driving improvement and care outcomes is concerned.
Yeah, and as part of that resilience and using technology to help with it, you and I had some conversations about telemedicine in Ghana and how the rise of that during the pandemic helped build health system resilience. So maybe you could tell us a little bit about that as an example as well.
Yes, so that is also currently ongoing in a lot of the settings. I mean, there are very simple mobile devices that are being used, especially in HIV care, for instance. Mobile devices, alerts are sent to patients and they know that they are due for their medications and then they can pick their medication refills, for instance. It is also being done for other non-communicable diseases like hypertension and diabetes as well, where reminders are sent to patients. I know also that in some of the facilities, when it comes to surgery, where the referring centers are able to guide the referral facilities through the tele devices, and they guide the surgical team in lower facilities as far as surgeries and other care is concerned. We did an evaluation of a project where we evaluated an intervention. This was the Ghana Heart Initiative. They had uploaded protocols on some of these devices, which was accessible even to the least facility, so that these people, with the use of their mobile devices, they can access protocols for the care of various non-communicable diseases. And it made life easy for these people at the lower end of the healthcare system. But it varies, and I think we are yet to see the full potential harnessed for improved care outcomes.
You brought up a whole range of technology interventions, such as reminders through phones and access to clinical protocols and guidelines. And really, it's amazing to look at some of the health system improvement efforts that have gone on around the world with this high penetration of mobile devices, right? And using patients' phones to help deliver some of those innovations. Those were some really important innovations that your organization has been working with to strengthen and build resilient health systems in Ghana, as well as the other countries that your organization works with in Africa. Clearly, these are really important to make sure that, I shouldn't say if, it's more like when the next health system shock comes around, that your health systems preserve their capacity and the ability to take care of their patients as much as possible. So now that we've spoken about some of these really heavy topics in healthcare, I usually like to end each episode by trying to learn a little bit more about the city or country or region that our guest is in. In the US, one of the things my family and I really enjoy doing is exploring all of the amazing national parks in the United States. We've been to so many of them to visit them and appreciate nature there and a hike there. And so, national parks, I think, are really treasures in a country. And I read that Ghana has some amazing national parks as well. For example, I read that Kakum National Park, it's a tropical rainforest reserve where visitors can walk across canopy bridges that are 130 feet above the ground to appreciate its views, its wildlife, and its 650 species of butterflies. That was absolutely amazing. And in the Northwest Savannah, Mole National Park is famous for its elephants, its leopards, antelopes, and over 250 bird species. So, those areas are definitely what I would put on my list of places to visit there. So, tell us about something that you'd recommend a first time visitor to Ghana check out, either a place to visit or a new food to try out.
Yeah, so the Kakum National Park, for instance, is a place to visit because it is in the south. And when you travel, you will come to Accra, and Accra is in the south. It's a bit closer to Accra. So it should be about 3 hours drive from Accra. Otherwise, if you would also want to see the north, then the Mole National Park, there's a flight connect to the north, which is just about 60 minutes flight from Accra also to the north. And then you can do a journey of about 3 hours as well to the Mole National Park. Yeah, so these are two interesting places that to visit. When it comes to food, I mean, our staple foods, so there is often a competition between us in West Africa, especially Ghana and Nigeria. And one of the staple foods that attract a lot of competition is what we call the jollof rice. So there is often the talk that Ghana jollof is, if you talk to a Ghanaian, he or she will tell you Ghana jollof is more nicer than the Nigeria jollof. If you talk to a Nigerian, he or she will also tell you their jollof is nicer than the Ghanaian jollof. Yeah. But I think that is one popular staple food to taste if you are a rice person. But otherwise, because the foods are according to the tribes and cultures of the various regions, and there are plenty, just a lot of variety for you to choose from. And I don't think you will be bored at all. You will always find something to get once you are here.
So the cuisine seems really interesting. And if I do visit Ghana, I'll try to make my own judgment about this battle of the Jolloфs to see which one comes out ahead. So I'll for sure check that out. And those are all the questions I have for you today. So thank you, Elom, for joining me on Mapping Healthcare. And it was fabulous to get to know you a little bit better and to learn about your important work in designing resilient health systems in Ghana.
Thank you. Thank you very much for having me.
So that was Dr. Elom Otchi telling us about challenges facing health systems in Ghana and how the country is working to build a resilient health system. You also heard a little bit about the Jollof rice debate, a source of national pride and friendly rivalry between Ghana and Nigeria. I didn't want to put Elom on the spot asking him for recipes on the show, so after our conversation, I looked up how I could make Ghanaian and Nigerian Jollof rice. They share the same basic ingredients: tomatoes, onions, ginger, chili peppers, red bell peppers, garlic, and chicken broth. They also have similar cooking methods, but Ghanaian Jollof often uses basmati or jasmine rice for a fluffy texture and milder flavor, and Nigerian Jollof uses long grain rice for a soft and moist texture and a spicy flavor. Alright, that's all I have for you today. This was your host, Dr. Sheikh. You were listening to Mapping Healthcare on KDRT 95.7 FM, where we explore healthcare around the world, highlight people who improve it, and share what we can learn from them. This episode featured music by Riala. You can hear Mapping Healthcare around the world anytime on kdrt.org and wherever you get your podcasts.
It's all